Alaikum wa rahmatullahi wa barakatuh. Now, before I begin, I just want to thank you all for being here and giving us your precious time. We really do appreciate it. Now, when I say we, who are we? My name is Umar Ahmed, and with the help of a very special guest, as well as 24 of my other colleagues from the third year of College of Medicine, we have created an extraordinary, knowledgeable, and descriptive presentation on a certain topic that's very important in the modern medical world. And that topic is how to reverse the invisible disability of chronic pain syndromes. Now, the speaker of today is going to be Dr.Ali Alqahtani. Dr. Ali is a consultant in chronic pain, musculoskeletal, and family medicine. He's a founder of Surgery Alternatives Chronic Pain Center in Riyadh, the first center of its kind in Saudi Arabia and the Middle East. He had created a 30-month fellowship training in McMaster University in Canada in 2008, and he was the first graduate from it in 2010. Dr. Ali is an expert in the comprehensive regenerative medicine for chronic pain, chronic diseases, and premature aging. He had been a principal contributor for creating the rules and regulations for chronic pain relief centers in the private sector in the kingdom with the Ministry of Health. He participated as a speaker for 5 different international conferences. He obtained the Saudi and Arab Board in Family Medicine from King Abdulaziz Medical City for National Guard in 2000. He is also a former member of the Canadian Academy for Pain Management Training Faculty. And now, before I let him speak, I have a question for you. Which one of you can tell me what they know about chronic pain in general? Who would like to volunteer? Go ahead, please.
So for what I know is usually the pain isn't really understood why it's there. And it's chronic, so it's there for a long time, and it's pretty physical. It's pretty bad for the person.
Yeah, that's the exact answer I want to hear. Music to my ears, actually. But I'll let the doctor speak on that topic. Now, I want to make sure you guys are attentive. Why? Because in the end, we're going to have a competition, an interactive question and answer session through Kahoot. And there's going to only be one winner. And that winner is going to get a big prize. So make sure you're listening. And without further ado, I'd like to give the floor to Dr. Ali Alqahtani, ladies and gentlemen.
Okay, thank you very much. Thank you very much for having me, and it's given me great pleasure actually to present to you a new concept about medicine and about chronic pain medicine. Today I am here just the main or the key reason for being here is to deliver one key message to you, because I have been through the same experience you are in now. So between the year 90 and 96, I studied medical school at King Saud University, and at that time we see our teachers like treating patients with pain using like certain approach, including painkillers like non-steroidal opioids and muscle relaxants, and sometimes they refer patients for surgery. And after I graduated from the College of Medicine, I was thinking that I have an absolutely complete knowledge, and I was thinking that this is. I was not thinking that there is another area of medicine that is not included in our curriculum, College of Medicine. And the main reason for this problem is the economic dominance, which is making a problem worldwide. 5 years after graduation from medical school, when you graduate, 5 years after your graduation from medical school, about 50% of what you have learned will be expired, outdated, which means wrong. So if you continue using it, it will be a problem for the community, okay? And how can we prove this, that this is true? Now, every year, 1 million medical research are published. And we have a huge body of evidence that brought to us a much better understanding of chronic pain and chronic disease and medicine in general and surgery also. So we have large body of evidence. It's there since before I graduated from College of Medicine, and it keeps building up. So there are much advanced and much better solutions for chronic pain, chronic diseases. And I was able to discover this fact maybe 15 years after my graduation from medical school. My talk today represents an example of how conventional Western medicine deals with chronic pain and chronic diseases. Today I will be mainly talking about chronic pain, and I will be talking about a more advanced medicine, which is integrative medicine, integrative and functional medicine, which is being taught now by more than 50% of universities and medical schools in North America. And I don't know how many of you are aware of integrative medicine or functional medicine. And if you're aware of this kind of medicine, integrative medicine, functional medicine. Okay. It's now being taught in more than 50% of the universities, and it's spreading, and it's the very near future medicine in the Kingdom of Saudi Arabia and most countries of the world. So the main goal of this presentation is just to make you aware of this. If you just take this message, this is more than enough for you today. Even if I didn't talk about my subject. My talk is about a very common health problem in the community, which is chronic pain syndrome or chronic pain syndromes, which is very common, which is affecting the quality of life of many people, especially women. And it's actually associated with unseen disability. Okay, and yet it's not properly diagnosed, it's not treated, and medical schools, they don't have any sort of appropriate medical education so that they can know how to deal with chronic pain in their future. Because whatever specialty you go to, you need to know about chronic pain, whether you are like family physician or internist or surgeon, or you need to know how to treat chronic pain. So what is chronic pain? First of all, what is pain? Pain is an unpleasant sensory and emotional experience associated with actual or potential tissue damage, or explained in terms of such damage. Chronic pain experience has 3 components that include sensory, emotional, affective, and behavioral components. So there is no pain without emotions, and there is no pain without affecting the behavior. A chronic pain is defined by the International Association for the Study of Pain as pain that persists or recur for more than 3 months. We have different kinds of chronic pain, including overuse, traumatic musculoskeletal, which is usually due to failed healing. We have the neuropathic nerve pain, which is affecting the nerves. We have the visceral pain, or visceral chronic pain syndrome, like irritable bowel syndrome and inflammatory bowel disease and others. We have inflammatory and autoimmune pain, like rheumatoid arthritis and other autoimmune disease. And we have infectious, like viral infection, herpes zoster. We have the headache pain, psychogenic pain, which is rare. We have central pain and cancer pain. Chronic pain is not a symptom. It is a chronic disease. It is the most complex disease ever. It is the most complex chronic disease. So it has multiple underlying changes at the level of the cell, at the structure and function of the cell. So it is associated with psychological and social problems, but the micro dysfunction is in the cells, and the macro dysfunction is the things that we see when the patient complain of difficulty walking, disabilities, etc. So we have about 13 underlying cellular mechanisms for chronic pain, and the same mechanism actually present in most lifestyle associated chronic diseases. So we have the extracellular matrix dysfunction, because the extracellular matrix stiffness and pH determines the synthetic function of the cell. And the extracellular matrix depends on what you eat, depends on your physical activities, depends on the hormones in your body, hormonal imbalances, etc. Usually in chronic pain patients, they have chronic oxidative stress at the cellular level and chronic inflammatory response and associated immune dysfunction because of the chronic stress response. Because chronic stress response associated with pain usually cause immune dysfunction, which is chronic. And also chronic pain patients have a chronic stress-related inflammatory response. So they have systemic inflammation. The gut microbiome-related intestinal barrier dysfunction, any chronic pain problems like lower back pain, neck pain, IBS, you name it, is always associated with dysfunction in the gut microbiome. And gut microbiome-related diseases is one of the most important discoveries in this century. You need to know about it, the role of microbiome, because if you have any disease, you have dysfunction in the microbiome, whatever is that disease. The time will not help me to talk about all this in details. Chronic pain patients at the cellular level usually have DNA damage and altered gene expression. This is called epigenetics. It is different from genetics. Also, you need to know about what is epigenetics. Okay, epigenetics is not genetics that inherited genetics. No, it's influence on gene, changing the gene because of the environment. And you can't change your genes now. If you get stressed, your genes will work differently. The expression will be different, and it will lead to producing cytokines and inflammatory markers that will cause many chronic diseases. Chronic pain patients, because of the stress, they have high level of stress hormones, and that's why they have insulin resistance. So chronic pain can contribute to insulin resistance and diabetic and metabolic syndrome. Many patients have micronutrient deficiency, okay? That leads to pain and muscle problems and fatigue and cognitive dysfunction. Okay, this is very common. Many, or a great portion of the community have deficiency of the important minerals, the important or the essential minerals and essentials, vitamins, and it's not yet tackled by medical education. Okay, most of the physicians, they are not aware about this huge problem. Okay. With aging, usually patients have a decreased level of sex hormones like testosterone and other hormones and estrogens. And this is especially after 40, and it is associated with chronic pain, because as we age, the chronic pain prevalence is more, and incidence. It's much more common in the older people. Chronic pain patients usually have endothelial dysfunction. Their capillaries, the endothelium, which is lining the capillaries, is dysfunctioned. So they have leaky blood vessels, and they have atherosclerosis. And by the way, atherosclerosis starts during the adolescent, even childhood, and it grows gradually, and that leads to decreased blood perfusion to tissues over time, especially when we are 30 and above, and even in 35, they have significant leaky vessels, blood vessels. And it's very common in the community, by the way. This problem is a fundamental epidemic in our community, okay? So if you have decreased blood perfusion to tissues, that will lead to inflammation and degeneration of tissues. You will be predisposed to like osteoarthritis, muscle weakness, fibromyalgia, and many other problems. The end result of all these problems, all these cellular mechanisms is variable degrees of what is called neurosensitization. So the neurons are very sensitized. If you have like a mild problem, you have severe pain, which is not explained, I mean, logically by a pathology. And the cause of that is the neurosensitization, okay? And also all these mechanisms that I mentioned at the end lead to tissue degeneration, chronic. It's not, it takes years or decades. So tissue degeneration and impaired healing, which is responsible for pain chronicity. Okay, I know this lecture is not maybe at the level of medical student, but it is just an overview so that you have like a general understanding of what is chronic pain and the thing that you need to direct yourself to learn about. Dimensions of chronic pain. Now I talk about the nature. So chronic pain has a cellular nature, cellular dysfunctions underlying it. Now what are the dimensions? Chronic pain is a constellation of problems, including physical dysfunction. Patient will have difficulty in executing daily living tasks, and they have variable degrees of chronic fatigue and tiredness. This is very common, okay? And by the way, all these problems are treatable and reversible. They have mental dysfunction, chronic pain, severe chronic pain patients. They have stress-related cognitive impairment. So they have poor focus, especially during work. They will have a sleep problem and chronic stress. Some patients with severe chronic pain have frustration, depression, inner feeling of being alone, and also rarely suicide thought and suicide attempts, because some patients they fail to find solution and they cannot live with their pain, okay? Also, chronic pain patients have social dimensions, okay? Like loss of role in family and work. For example, a woman who is a wife and mother, okay, who has severe pain, chronic fatigue, lack of focus, stress, easy anger, and all these are symptoms and signs of chronic pain syndrome, okay? So, but she doesn't have disability. They don't see any disability. So they will explain it or rationalize that as psychogenic, which is not true, okay? So she starts losing her role as a wife, maybe as a physician or as a teacher, and then she will be in a conflict at work and because they don't understand her suffering, okay? And also loss of income is a major problem associated with chronic pain. Okay, chronic pain patients fall in one of three categories. We have patients who have chronic pain that is not complex, mostly moderate. They don't have psychiatric problem, they don't associated psychiatric problem, they don't have associated physical dysfunction, okay? And this is more common in male compared to female. We have the severe complex chronic pain patients group. This kind of pain is more common in females, okay? And they have severe pain or extreme pain with severe psychiatric comorbidities, okay? And they have severe social dysfunction. And they are, you can describe them as disabled. They describe themselves as existing but not living. We have a third category of patients. So those are the patients who are having severe complex chronic pain because of the interpersonal conflict. Their pain is not understood by their doctor, it's not understood by the family, and it's not understood in the work. So they become, they live in a conflict with others, okay? And sometimes they explain their pain are psychogenic, which is mostly not true, okay? And this conflict, interpersonal conflict, put them in or keep them in chronic severe stress, okay? The chronic severe stress increase the intensity of pain, increase the intensity of depression, increase the intensity of dysfunction because of the neurosensitization, okay? What is the situation worldwide regarding pain medicine? In the Western countries and here in our country and Middle East, we have a problem of high rate of wrong diagnosis. John Hopkins physicians have conducted a study in the United States, and they found that chronic pain patients are misdiagnosed 40 to 80% of times. Usually the diagnosis and the care, it doesn't focus on the root causes of chronic pain. It is just pain relief using unsafe medications and interventions. Unsafe and which is not cost effective as well. Chronic pain costs the United States $600 billion a year. Most of this amount of money doesn't help people to get rid of their pain and suffering. So most of it is waste of resources. The knowledge used to treat chronic pain is dissociated knowledge, okay? Chronic pain specialty is fragmented because many doctors deal with chronic pain, but there is no one physician who understands the whole picture and who can diagnose and treat the case, okay? The practices are dissociated because you will have orthopedic, you will have pain relief clinic, you will have rheumatology, you will have family medicine, but actually there is a huge gap in the knowledge and in the skills. We have a problem here also in the kingdom of high rate of unnecessary tests and high rate of surgical treatment that do more harm than good, okay? And painkillers carry many risks. Actually, I will just give you example. If a patient sustained myocardial infarction and you give him Voltaren after the myocardial infarction, even 1 year after the infarction, you increase the relative risk of getting another MI is 50% because of using Voltaren. So these medications are associated with many risks and side effects. They increase the risk of renal failure, they increase the risk of atherosclerosis, they decrease the sperm count, and they have many other side effects. Opioids also in the United States, 115 patients die every day because of opioid overdose. They prescribe opioids for chronic pain in the United States and the Western countries, but here it's well controlled in our country. This is good thing. But it's good thing that it's controlled, but it's bad thing that people are having huge suffering, okay? What is integrative and functional medicine? Actually, integrative and functional medicine, some people name the new medicine as integrative, and some of the practitioners use the functional medicine. They are overlapping, and the main difference between integrative medicine and functional medicine is that functional medicine use more tests to test for functions, for dysfunctions, okay, of the systems or of the cells. Functional medicine is or determines how and why the illness occur and restore health by addressing the root causes of the disease. So it focuses on diagnosing the root causes and treating the root causes, okay? Integrative medicine, defining principles. It's holistic medicine. Integrative medicine is holistic. It's patient-doctor relationship focused. Okay, so both patient and doctor are partner in the decision. They have mutual understanding of the problem and the decision, and both of them look and work on finding out what is the root cause and how to treat it. Okay, it focuses on mind, body, spirit, and community, and it uses both conventional and alternative medicine options. And by the way, many alternative medicine treatments are called alternative medicine which is non-ethical. It is non-ethical to call some of these options alternative. Okay, they call it alternative so that it will not be covered by insurance, and so that it will not compete with the other conventional medicine or drugs that is given or that is marketed by pharmaceutical companies, which are very powerful at marketing. So we need to be aware of these things. It doesn't mean that drug companies, they have actually bright side and dark side, okay? In integrative medicine, effective interventions that are natural and less invasive should be used whenever possible and should be used first. And there are many, many options that is very safe, effective, and can even reverse many chronic pain and chronic disease. Integrative medicine neither reject conventional medicine nor accept alternative therapies uncritically. So integrative medicine use the medical ethics and evidence-based medicine. Treatments that go with medical ethics and evidence-based medicine are welcomed, okay, and cost effectiveness also. So it removes the barrier, the political barrier between conventional and alternative medicine. It doesn't mean that alternative medicine is all good. No, it's full of gaps. But when this medicine is studied by medical professional, they will be able to know what is good and what is not good for the patient. In integrative medicine, it's based on good science. It's inquiry-driven and open to new paradigm. طبعا health promotion and health prevention is paramount in integrative medicine. Now I will talk to you about how integrative medicine approach chronic pain, how chronic pain is treated using the new medicine or the integrative medicine or the integrative functional medicine approach. Now we have much better understanding of the cellular mechanism and the dimensions of chronic pain. So chronic pain is caused by multiple mechanisms, multiple underlying causes in the cell itself. Okay, so we need a treatment with multiple mechanism of actions. If we use just non-steroidal anti-inflammatory drugs for example, let's say osteoarthritis or fibromyalgia, we are targeting just one mechanism of the 13 mechanisms. Okay, so we are just trying to relieve the symptom. Not every patient will benefit from non-steroidal or other painkiller, okay? But we are also exposing the patient to harm. So we need to put the knowledge together, like this knowledge of cellular dysfunctions and the dimensions and the knowledge and skills of different medical schools. We need to put it together and to bring to the patient the best approach. Okay, so this protocol is a new protocol. Actually, it's I call it RRMMHS. Actually, it's double S. It doesn't mean that I have created the treatment. No, I just try to put the knowledge together, and so that we can give the patient which is more appropriate for him. Regenerative regenerative protocol or comprehensive regenerative protocol, it focuses on evidence and updated evidence, and it has multiple mechanisms of action to target the multiple root causes of chronic pain. And R is regenerative. First R, regenerative, which is include dextrose, prolotherapy, platelet-rich plasma, autologous platelet-rich plasma, and autologous bone marrow stem cells, and bone marrow, whole bone marrow, and also whole venous blood. All these are called prolotherapy. So dextrose is very effective, and it is alternative to stem cells and platelet-rich plasma. It's very effective. I have been using it for 10 years here in the kingdom with actually excellent results. We have the rehabilitative options, including physiotherapy, neurorehab, chiropractic, and osteopathy, and other options. We have the conventional medication. We still use some conventional medications like non-steroidal anti-inflammatory drugs for the young people who doesn't have risk, but for short term. So I don't use non-steroidal for more than 5 days. Why? Because I know the community has that most people in their who are above 30, they have some degree of atherosclerosis. Or if you prescribe this medication for a long time, you will increase the risk of, or you will make the atherosclerosis grow faster. Okay. Mind-body medicine. There is a branch of medicine called mind-body medicine. It includes food as medicine, as prescribed medicine. It's not food as general advice, because what's happening in our country, unfortunately, and in most parts of the world, the nutritionist clinic, they just give advice focusing on calories and number of calories, but there are many gaps. So food as medicine, food is studied in lab in the same way as we study new medications. So we study the micro elements of food on the cell and how do they like affect the cell and health. Also, it includes lifestyle as medicine. And pain psychotherapy. There is a specialty called pain psychology, okay? And also relaxation therapy like yoga and other things. Herbal medicine, we have evidence-based herbs. I mean, we have large body of evidence on many herbs that have excellent effect on chronic pain, chronic fatigue, and also dietary supplements. Many dietary supplements have great role in treating chronic pain and chronic fatigue, chronic stress, sleep problems associated with it. Surgical treatment, this specialty, integrative chronic pain medicine, help the patient to determine his or her need for surgical treatment. Okay, so that you don't undergo surgery that is not appropriate for your case. Okay, the take-home message. As I told you, 5 years after, this is the father of evidence-based medicine, has stated this, that after 5 years after College of Medicine, maybe about half of what you have learned will be expired or outdated, okay? Actually, the way of treating chronic pain and chronic disease didn't change since I was graduated from College of Medicine in 1996, okay? Unfortunately, this is very sad. Again, you need to know that integrative functional medicine is the near future medicine, okay? Because the Western conventional medicine, of course, it is the fundamental medicine is the Western modern medicine. It doesn't mean that alternative medicine will be in place of replacement for conventional. It will never be in the place of Western medicine, but when we come to the treatment, we have a problem in the Western medicine when we talk about chronic pain and chronic disease. Western conventional medicine has achieved great achievement in many fields of medicine, especially like emergency, ICU, surgery, ophthalmology. But when we talk about chronic pain and chronic disease, we have some problems. There has been great advancement in chronic pain treatment. Unfortunately, the large body of evidence that is available now is not yet incorporated into medical education in medical schools and in the postgraduate. Okay. Now I will just talk to you about, I will give you examples of some case scenarios from my practice that is implementing the new medicine or the integrative functional medicine, just to see the difference of outcome and how is the, I don't know how much time we have. Maybe I need 10 minutes. Is 10 minutes okay? I'll start to make it, okay. So, case one is 43-year-old male with severe disabling neck pain. So, when I was working in National Guard, I received one patient who has been in severe pain and disability over 2 months. And he was a husband of one of my colleagues. So after 2 months, of course, the story started 2 months before they came to me. He developed sudden onset, severe agonizing pain in the neck associated with severe dysfunction in the upper limb and loss of sensation and motor function of the thumb. Okay. He was seen in the ER, and he was given some opioids, and they were not able to figure out what is wrong with him in the ER, and he was admitted to the hospital for 2 weeks. And at the end, he was diagnosed as moderate disc protrusion in the neck as the cause of his pain. Okay. He was given 2 opioids and 1 non-steroidal anti-inflammatory drug. His wife was not. It was at the beginning when I returned back from Canada, so she was not aware of my specialty. So she asked me, and she said, "Could you help my husband?" I asked her to bring him, and he came to me using 2 opioids medication and 1 non-steroidal. He was in a bad pain, severe pain. He told me that his pain was relieved by 40% after using the medications, but he was having difficulty focusing and concentrating. He was not able to go back to his job. Okay. When I examined the patient, actually, I found that he has severe tenderness in the muscles of the neck, especially the scalene muscles. And as you know from your anatomy, scalene, the brachial plexus pass between the scalene muscles to supply the upper limb. And I found that the patient has something called severe myofascial pain and trigger points, scalene muscle, that was compressing the brachial plexus, and the disc has nothing to do with this pain, okay, because it's moderate. I take just dextrose with lidocaine as the treatment. That's what we do in such case. So I injected the scalene muscles, and the scalene muscle is when it's in a very bad spasm. Usually they get very short, and they compress the nerves. Okay. So when I inject the scalene muscle, he has immediate relief of his pain and 60% improvement in his sensation in the thumb. Okay. So after the injection, just immediately he got 60% improvement in his pain and dysfunction. And he went home and come back to me in 10 days because I gave him an appointment after 2 weeks to give him another session of injection. Okay. They came to me in 10 days, and I repeated the injection, and he got 100% relief of his pain and dysfunction. No more symptoms, nothing. Okay. And he is now enjoying his life for, this was maybe 5 years ago. He has no recurrence of the symptoms. He was disabled after he received the treatment, and he was in his way to lose his job. Okay. And the family was actually disturbed with this problem. Another patient, 45-year-old woman with severe chronic neck pain and severe dysfunction of the neck. A woman came to my clinic with complaining of severe chronic neck pain, severe tiredness and fatigue, severe brain fog. Okay, she couldn't focus, disturbed balance when she walked for shopping. She has depression, frustration, and she was describing her case as a person who is existing but not living. Okay, no quality life. She was suffering for over 5 years before she came to me. On examination, I found this patient was diagnosed before I examined. She was diagnosed as osteoarthritis of the spines, mild disc, muscle problems, etc. Okay, all treatment options didn't work. So on examination, I found that she has what is called cervical spine instability. It is not instability due to trauma, no, it's due to overuse. chronic flexion of the neck and wrong posture of the neck over time will cause laxity of the ligaments that is fixing the upper cervical spines. Okay, that will make the spine more mobile. I mean, it will move out of the range, even if it's 1 ml out of its range, and that leads to what? To irritation of the vagus nerve. Vagus nerve pass in front of the spines. Okay, and chronic irritation of vagus nerve will cause autonomic dysfunction. So it will cause pain, and also she developed trigger points in the muscles. Trigger points is when the muscle fiber twists. Okay, when they twist and they compress the nerves inside the muscles. So when we inject dextrose to the trigger points, it will be released like this. Okay, it will release the pressure on the nerves, and also in such case, what I have done to her is 5 sessions of multiple dextrose injections over 5 months. Okay, the aim for that is to strengthen the ligaments, because it's regenerating the ligaments, and also to strengthen the muscle, and to release the trigger points, and to regenerate the neck nerves. Okay, she got great improvement, 90 to 100% of improvement of her pain, dysfunction. She is having normal life, and now 5 years after this treatment, there is no recurrence of her symptoms. Okay. So I have many other examples. I will just take 2 or 3 minutes to give you different examples of cases. Another young man who is 28 years old, marathon runner. He's also a soldier, and he is also studying part-time in the university. While he was doing strength training in the gym, he developed sudden lower back pain toward the right side. He was seen in a large hospital, and he was diagnosed to have disc. Okay, disc prolapse. He came to me after 2 to 3 months, as far as I remember, and to take second opinion. So I reviewed his case, examined him, and reviewed the MRI, and I found that the disc is not severe, it's moderate, okay, and the symptom they have, it cannot be explained by it. So I examined his hip. I found a muscle called gluteus minimus, sorry. Gluteus minimus gives you a picture of sciatica. If you have trigger points in gluteus minimus or piriformis muscle, it will give you sciatica, same as if you have disc, okay? So when I press on the gluteus minimus, he jumped because of pain. We inject the muscle using dextrose, and it was released, okay? And immediate relief of pain. And I asked him, he was not able to come to me without limping. He came to my clinic limping. After the injection, he improved about 70%. I asked him to go to the parking area. He was able to go to the parking area and come back to me without limping. I repeated the injection 2 weeks after the first session. We usually use multiple dextrose injections, and he was cured completely, doesn't need any surgery, and he went back to his normal life. He came to me actually in a major depression, because he was thinking that he will lose his career. And so now, about 4 to 5 years, he has no recurrence of pain. So this is just an example, an overview of the chronic pain. How do we treat? Of course, it's not only dextrose, by the way. We use dextrose or stem cells, autologous stem cells. We use food as medicine. We use for fatigue. We use dietary supplements. We use some herbal medicine, sometimes conventional medications, okay? And sometimes we refer patients for surgery, okay? So it doesn't mean that we don't, because we use both conventional and alternative. Thank you very much for listening. I hope I didn't take long time.
Well, I want to use this opportunity, Doctor, to invite you to integrate this very informative new field of medicine into our curriculum, inshallah, through the family and community medicine courses, or even as a separate course, because
My
we
pleasure.
really very much enjoyed this wonderful, thoughtful, and informative presentation. On behalf of myself and the third-year students and Alfaisal faculty, I would like to thank you very much for joining us today at a short notice. And inshallah, we look forward to many future, inshallah. Collaborations in the future. Thank you so much.
Thank you.